We just started recording this session, which we'll touch on in a sec. I'll give you a couple seconds, get settled in, chill, relax. Thank you, like big time, for joining us. This is awesome. We appreciate you very much. Taking the time. All right, we'll get started. I'd like to officially welcome you to Cancer Care Manitoba's World Cancer Day webinar. We really appreciate you taking the time to learn a little bit more about cancer, advances in cancer treatment, and how we can make some small changes in our daily routine to prevent cancer. My name's Ace Burpee, and I host a show on 103.1 Virgin Radio, and there's a picture of my dog who's beside me. You just can't see her, but I'll be your host and take you through this session, and then I'll moderate a Q&A at the end. Before we officially begin, I'd like to acknowledge that we are in Treaty 1 territory. The land on which we gather is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. Couple of housekeeping things. One is this session is being recorded and shared. All right, so we will post the entire thing at the beginning of March on Cancer Care Manitoba's website. Q&A. Okay, so you use the Q&A icon at the bottom of your screen to ask any questions. There are no dumb questions, for real. You're in a safe space. We've got you. So don't just, the thing is though, use the Q&A one, not the chat, okay? And then throughout the webinar, we'll jump in once in a while with a little quiz, and we'll use Kahoot. So if you go to another web browser, then so let's say you're using a laptop or whatever it may be, but you have a mobile with you, then go to kahoot.it, kahoot.it, all right? And you enter the numbers on the bottom of your screen. So today we are using 2515249. So you go to Kahoot, KAHOOT.IT, Kahoot, and you enter those numbers on the bottom of your screen, 2515249, 2515249. And then once you're on there, you can press spin, and it randomly selects your nickname for the game. And you'll know you're in if you see the webinar slide on your device. If you don't have access to Kahoot, that's cool. You can discuss what you think the correct answer is, and then share it with those around you. Do I need to look at this chat? I might. Oh yeah. Shout out Gillum. Shout out West K. Okay, we'll start with a sample question and see if it's working properly. So this is what it looks like. Oh, that's awesome. I don't know, like sometimes it plays. Yeah, there it is. So this is just, there's no wrong answer obviously in this, but this just to see if Kahoot is working. The soundtracks on Kahoot are really good. Yeah, great. Great. Awesome. Okay. If you do have any issues or whatever, by all means, jump in the Q&A on Zoom and we'll attempt to address them best we can. I'd like to now introduce the CEO and President of Cancer Care Manitoba. I am a massive fan, Dr. Sri Navaratnam. Dr. Navaratnam, everyone.
Thank you, and good morning and welcome. This is the first time Cancer Care Manitoba is reaching out through this way to the high school students to talk about cancer. So first of all, my sincere thank you to each and every one of you. for joining this. And I hope you will have a good time and learn more and to practice more on prevention, cancer prevention. So Cancer Care Manitoba, our mission is to have cancer control. We want to have less people with cancer in our province. And even when they have cancer, it is a life well lived. So cancer control, prevention, we cannot do it alone. We can only tell you, but we want each one of you to participate. As Ace was telling, this webinar is organized in the honor of World Cancer Day. That was last Friday. The theme of World Cancer Day is closing the gap. So we need to reflect and think as each one of us, what can we do to closing the gap? What do you mean by closing the gap is one is equitable care. Globally, even within Manitoba, there is a gap in the care that everyone receives. And second thing is we want to bring the research more closer to the care. And finally, we want each Manitoban to practice prevention so that we will reduce the risk of developing cancer. So that's what, so sit back, as Ace was saying, we are going to learn a bit about what is cancer, how do we treat, and how could we prevent this cancer, which you could share it with your families and friends and dinner table tonight. And so we wanted all of you to be the champion in practice cancer prevention. Now, what I want to do is I wanted to invite Genevieve, who is one of our, Genevieve Richardson, who is a patient advisor, who is living well with cancer. As I said earlier, we don't want the Manitoban's life to be cut short with cancer, but when they get cancer, we want their life to be well lived. And her story is very inspirational. And please kind of reflect on her story and to see how, as each Manitoban, we could contribute to reduce the cancer in our province. So here you go, Genevieve, to you.
Most of us know or will know someone who has been affected by cancer, but you never really think about it happening to you. For me, I never gave it much thought until almost 6 years ago. I had just started a new job and I had recently gotten engaged and was planning my wedding that was only 3 months away. My life was so busy and I had so much to look forward to. It was a spring day like any other until I found something that wasn't right. I decided not to wait and immediately booked an appointment with my doctor. It was such a scary time. I ended up being diagnosed with breast cancer. The doctor said I needed surgery and chemotherapy. Suddenly, my focus shifted from my work meetings and wedding plans to medical appointments and learning about my diagnosis. It was overwhelming and things moved quickly. The doctor scheduled a surgery date within a month of my diagnosis and said I needed 8 weeks to recover. I wasn't going to let cancer ruin my plans. I focused on my love, my family, my friends. I walked down the aisle and married the love of my life only 7 weeks after surgery. It was everything I dreamed it would be. After a short honeymoon, I started chemotherapy a week later. This was a really challenging time. After diagnosis, I struggled mentally with the idea of living with cancer, but now I was also struggling with the physical effects from the chemo. I felt sick all the time. I had no energy. I lost my hair. It felt like I had lost my identity. I was sad, but through it all, I knew I would get better. And a wig certainly helped in the cold Winnipeg winter. 8 months after chemo, the cancer wasn't out of my mind, but it was certainly in my rearview mirror. My hair started growing again. I went back to work. We went on a trip. Life was getting back to normal. Another year passed and we started planning a family and bought a new home. It was right around that time that I started feeling pain in my ribs and back. I was afraid to get more tests, but knew something wasn't right. And I received the devastating news that my cancer had spread to my bones. It was now considered incurable stage 4 cancer. The doctors explained the goal of my new treatment would be to slow or stabilize the growth. With this diagnosis, it meant that I wouldn't be able to have children, which was heartbreaking. I would also need to go through chemo. I was so scared and didn't want to face that again. However, I knew it was my only viable option to fight back against the cancer. And fight back I did. I fought through 8 more rounds of debilitating chemotherapy, and it worked. It drastically decreased the amount of cancer in my body. Living with cancer, I consider myself a cancer thriver. I currently go to the hospital for an intravenous treatment every 3 weeks. I still have to deal with side effects and symptoms, but it's not as bad as chemo. Waiting for results from scans and tests every 3 months is nerve-wracking to say the least. I call that scanxiety. Some days are easier than others, but I think it's important to try to live in the moment and love every day. I'm fortunate to have the love and support from my family and friends. My teenage nieces, who are around the same age as many of you, are a shining light. They cheer me up, they distract me when I'm having a bad day, they call me Cool Aunt Jen, even though I may have given that name to myself. Knowing my diagnosis, I'm sure it isn't easy for them at times, but they help in ways they'll never know. When I was recovering from chemo the last time, I needed some cheering up. We needed some light in our lives, and we got a golden retriever puppy. His name is Bodie Bear. He was supposed to be a calm therapy dog, but he was anything but calm. The therapy he ended up providing was in the form of snuggles and never-ending play sessions. In the end, he certainly helped my recovery, so I couldn't give this presentation without giving him a shout out. So to end here are some pictures of Bodie. Hope you enjoy.
It's a good looking dog. Hi, Bodie. Jen is amazing. I know her well, and it's so incredible of her to be so open and honest with her story, her cancer journey. And she, like she said, she's a thriver, which I love. If you joined us at like a little bit late, that's cool. We don't want you to miss out on, we're doing a couple like quizzes. So if you have a mobile, Kahoot.it, Kahoot.it, Kahoot.it. If you jump on there and you enter 251-5249, 251-5249, it's in the chat as well. Then you can play the quizzes with us, which, yeah, let's roll into one. So we'll start with a, this one I wouldn't even have, like, I guess I could have guessed it right, but I don't know. Let's try one. So our first question, first quiz is the total length of DNA in a human cell. The total length of DNA in a human cell. Got yourself 20 millimeters, 10 centimeters, 2 meters, or 100 meters. Not gonna lie, I like the music. A lot. 20 millimeters, 10 centimeters, 2 meters, or 100 meters. If you selected 2 meters, I wouldn't have, full disclosure. You are correct. Super lizard, okay, pause on that for a sec. Super lizard, awesome raccoon, gentle finch, blue dingo, sweet, swift unicorn. The names are amazing. Super lizard, you get more points if you answered like super quickly. So super lizard, you are indeed super. Well done. Okay, to explain more about DNA and the science behind cancer, spoiler alert, there is another DNA stat or number in his presentation. And I remember it distinctly from the other day, and I think I'm gonna have to declare it mind-blowing. All right, to explain more about DNA and the science behind cancer, we are joined by Dr. Kirk McManus, a Winnipegger and senior scientist within the Cancer Care Manitoba Research Institute, a professor in the Department of Biochemistry and Medical Genetics at the U of M. His research interests focus on identifying and characterizing genes that regulate chromosome stability in cancer and exploiting these genes to identify novel therapeutic targets. He currently couples state-of-the-art genetics, biochemistry, and cellular biology, along with innovative digital imaging, microscopy to identify both genes and targets of interest This is Dr. McManus.
So my goal today is to provide you with an introduction to cancer and really answer the question of what is cancer. And to do that, I'll provide you with a little bit of information on DNA and the genes that are critical for the development of cancer, as well as information on the types of cancer, cancer staging, and cancer treatment. But I think if you ask most scientists and oncologists what cancer is, they would indicate that cancer is a defect of the cell cycle, particularly with respect to ongoing replication or proliferation. So in this schematic, a normal cell represented in pink converts into a cancer cell. And as you all know, cancer very much rapidly divides to ultimately produce a tumor. But at the heart of that is defects in the cell cycle. And the cell cycle is really a process by which a cell goes through to prepare itself to be able to divide. And there are certain checkpoints in that have to be maintained and are actually lost in cancer. Just a little bit of information on some of the DNA. As you all know, chromosomes are the structural units of DNA. And in humans, there are 23 pairs or a total of 46 chromosomes in every human cell. And in fact, if we took that DNA from those chromosomes and unwound it and laid it end to end, that would equate to approximately 2 meters of DNA per human cell. That's the equivalent of approximately 40 kilometers of a very thin thread thrust into something the size of a tennis ball or a nucleus. But not only is it pushed into that nucleus, but rather it has to be organized in a manner that allows certain genes to be accessed and expressed and other ones not expressed. So each human has approximately 2 times 10 to the 11th kilometers or 200 billion kilometers of DNA. That's roughly the equivalent of 66 round trips to the sun and back. Now, this is an extraordinarily thin thread, and the weight of which is only 300 grams, or roughly 300 paper clips. So it's not difficult to envision how defects in the genome or this DNA blueprint can really adversely impact cell biology and contribute to cancer development. Now, here is an image of a microscopy technique where we're able to independently label all 23 pairs of chromosomes. And you can see that this is a normal individual or a normal cell. But in cancer, that normal balance is very much disrupted. Here we can see what's called numerical changes in chromosome numbers. So rather than the 46 copies that you would find in most human cells, we find 127 copies. So each chromosome is massively amplified in this single example of a breast cancer. But this can be applied to many different cancer types. Similarly, we can also see structural variants. So while we see the regular number of 46 chromosomes, what you'll notice in many of these chromosomes are banding patterns, indicating fusion proteins and fusions have occurred between these specific chromosomes. Really, there are 2 classical genes that are implicated and affected by those types of numerical or structural changes. The first one is oncogenes, and these are really referred to as the cellular gas pedal. It's as if a car really has those accelerators stuck. As a result, the genes are turned on and the proteins have increased expression and function and really are driving cells around that cell cycle. The second genes, which really keep those oncogenes in check under normal conditions, are referred to as tumor suppressor genes. And in a car analogy, these are really referred to as cellular brakes. And in fact, in most cancers, you lose both of the cellular brakes, both your pedal brakes as well as your emergency brakes. So these genes are turned off, and as a result, they are often decreased in expression or function in many different cancer types. Now, moving back to those cell cycle, there are a number of stop signs, or also referred to as checkpoints, that normally prevent the cell from prematurely progressing through the cell cycle to ensure that it's ready to move through and ultimately divide. And so those genes very much play roles in those. Under normal conditions, those oncogenes are pushing the cells through the cell cycle, but those tumor suppressor genes are acting as those brakes at those specific checkpoints to allow DNA repair genes to normally come in and repair the genome. But if we lose those tumor suppressor genes or those brakes, those cells will go through the cell cycle and accrue many mutations that may ultimately contribute to the development of cancer. In general, there are 2 cancer types. On the left are liquid or hematological cancers. These are broken down into 2 types. First and foremost is leukemia, which arises through blood-forming tissues or cells, and an example is acute myelogenous leukemia. A second type is lymphoma, which again arises through blood cells, but of a specific type, those being lymphocytes. And an example here would be Hodgkin lymphoma or Burkitt lymphoma. Now, the other type of cancer is a solid cancer, and this again gets broken down into two types. Carcinomas, which you may be most familiar with, these arise through defects in epithelial cells or linings of organs. And these can include breast, colon, lung, and liver cancers. Alternatively, we can have sarcomas, which basically are defects in the supportive tissues and can include bone, cartilage, or muscle. And an example here is osteosarcoma or bone cancer or fibrosarcoma. Now, in general, there are more than 200 distinct types and subtypes of cancer. In fact, it's estimated there's at least 18 distinct breast cancer subtypes. And it's really this diversity or heterogeneity that makes it so challenging to combat these specific cancers. Another term you may have heard of is cancer staging. And this is a very important aspect of cancer biology because it provides the medical team with important information and insight into the patient's cancer. It provides information on location, cell type, tumor size, and spread, or whether or not the disease is metastasized throughout the body. So in this schematic in the middle, it's a single example from colorectal cancer, where we have a cross-section of the bowel, and I'm just showing you the different stages from stage 1, effectively up to stage 4. Now, stage 1 and 2 are referred to as early stage, and that is because this disease is locally restricted. And that generally means that the disease remains in place where it originally started. Stage 3 and 4 are late stage or more advanced stages, and these are usually stages at which the disease has begun to spread or metastasize throughout the body. And in fact, in stage 4 shown here is colorectal cancer often metastasizes to other organs, like in this case, the liver. Now, tumor staging is very important because it provides that critical information that's used to develop those treatment strategies. But what are the factors that impact treatment decisions? First and foremost, the tumor type, whether or not it's liquid versus solid, tumor staging, whether or not it's locally confined or begun to spread throughout the body, and again, patient characteristics such as their age, health, obesity, or other factors. In general, there's two types of treatment strategies. One is a local therapy, typically for those early stages when the disease is restricted to where it originally started, and those include surgery and radiation. And the second real treatment strategy is systemic treatments for more of those late stage diseases. And this typically involves chemotherapy. Now, I hope today I've provided you with a little bit of information and an introduction to cancer biology and begun to answer the question of what really is cancer. And with that, I thank you very much for your attention.
These are surgery, radiation, immunotherapy, or chemotherapy. Those are your choices. Take a sec. Surgery. This is the first type of cancer treatment. And let's see what we got. Okay, so surgery got the most votes. Radiation second, I'll be honest. I would have gone radiation. I would have been incorrect. The answer is in fact surgery. So congratulations. Awesome Raccoon obviously jumped in early. Huge move. Aw, there's a lucky deer, everyone. All deer are lucky because they're awesome. Magic Gazelle. Magic Gazelle could be a movie or a kid's book, and it would absolutely rule. Side note. Our next presenter, everyone, is Dr. Peter Chakowski, a medical oncologist and the Chief Medical Officer at Cancer Care Manitoba and Associate Professor, Max Rady College of Medicine, University of Manitoba. In addition to his roles at Cancer Care Manitoba, he also teaches in the U of M Medical School and does research in cancer outcomes. Dr. Chakowski is married, has a daughter who graduated from Kelvin during the first pandemic wave, and loves walking his adorable, massive poodle on the Assiniboine River trails in the winter. Please, Dr. Chakowski.
So it's my pleasure to speak to you today about how we treat cancer. And we just start by talking about the players. Oncologists are the doctors who treat cancer. They're supported by large healthcare teams. We have surgeons who operate on cancer, radiation doctors who give radiation, and we have medical oncologists who give drug treatment. It's really important to know what your goal is. In some patients, we're aiming for cure. That means we're completely eliminating the cancer. This usually involves major surgery, but we can also cure some patients with radiation and even some with drug. There are some patients where we're trying to prevent recurrence. After surgery, the cancer can sometimes come back. And if we use radiation and drug therapy, we can often prevent a recurrence. There are also patients where we know we can't cure or prevent, where our goal is to control the cancer. This is particularly those whose cancer has spread, and our goal with any of these treatments, surgery, radiation, or drugs, is to slow the cancer down, improve symptoms, and improve the quality of life. So how do we do this? Surgery is probably our most important tool in terms of cure. We've been using surgery probably for 4,000 or 5,000 years. Almost every patient has a biopsy, which is a sampling of the cancer. About 45% of patients have a surgery to try and cure their cancer. And sometimes if the cancer is spread, we'll use surgery to try and cut that out too. This is a colon cancer in the red circle there in the middle. And I'm just showing you that if we use surgery, we cut where those two blue arrows are, we can remove that piece of cancer and the lymph nodes and sometimes cure the patient. This picture is a CT scan, and you can see a liver in that blue triangle. And in the red circle is a metastasis. The cancer spread to the liver. And in this case, it was removed surgically, and the patient did well. We're now getting into these really fancy ways of doing surgery. There's even robotic surgery where there's a machine that operates on the patient controlled by the surgeon who's on the left there. So probably the perfect job for a star gamer. This is a slide of a patient of mine who decided to decorate his surgical scar and was quite proud to show that off to me. We also use radiation treatment a lot. About a quarter of patients have radiation. We use it to cure, to shrink cancer, make surgery easier, to prevent recurrence, and to help symptoms. Most radiation is delivered by what's called external beam, and here you can see a linear accelerator. It's a $5 million machine that shines a radiation beam on a patient. There's the couch the patient lies on. Here's a thing called a gantry that spins around the patient and shines radiation from multiple directions. And with this, we can sometimes cure cancers. Sometimes we'll implant radioactive seeds. So right here, you can see a bunch of gold seeds in a man's prostate. And they're slowly letting off radiation that helps get rid of the cancer. And finally, here's a bone scan. You can see a skeleton. You can see a lot of black dots, and those are cancer in the bones. And we can radiate those because they're often very painful, and radiation will help that. We do use drug treatment in about a third of patients. We've had drugs for about 70 years. Initially, we only really had hormonal drugs and chemotherapy, which can have a lot of side effects. Now we're still using those drugs, but we're adding a lot of other things like targeted therapies, antibody therapies, immunotherapy, where we get the body to wake up the body's immune system so it'll fight the cancer, and something called precision medicine, where we try to target the mutation specific to a cancer. We can cure some cancers, lymphoma, leukemia, testicle cancer. Here's a patient of mine who had a big cancer in his chest. This is a CT scan. You can see in the circle a cancerous mass. After chemotherapy, it's shrunk to almost nothing, and the surgeon was able to cut it out for us. I'll show you one more slide of him at the end. We also use chemotherapy and drug therapy to prevent recurrence after a variety of cancers. And we use drugs to keep people living longer. So even with incurable cancer, sometimes treatments now will help them live 2 or 3 times longer than they used to. And there may even be some patients that we're curing now that we didn't before. Here's a chest and a CT scan showing tiny little nodules. These are all metastases and made this patient quite symptomatic. And some chemotherapy helps shrink those and improve the situation. So we're using treatment for cancer of a variety of sorts. It's a rapidly evolving field. Surgery is becoming safer and less invasive. Radiotherapy is using new tools and new techniques. And there are all sorts of new types of drugs and new indications. So said I would come back to my patient. This is the body art that he chose to represent his cancer after he was all done treatment and was cured. So thanks for your attention, and it was a pleasure speaking to you today.
Right on. Appreciate you, Dr. Chakowski. Appreciate you very much. I just wanted to pass this along. So think a lot of y'all are grade 10. Maybe there's 9s, 11s, 12s. But this is cool. So you have to decide your future right now. You'd take as long as you want. But Cancer Care Manitoba has a partnership training program with the UW, so the University of Winnipeg, and it trains radiation therapists who can then work here in Winnipeg, Brandon, across Canada, around the world. So radiation therapists plan and treat radiation patients under the direction of radiation oncologists. So if you are interested, if you're like, yo, that might be my thing, you can check out the School of Radiation Therapy info on Cancer Care Manitoba's website. Awesome. All right, let's do a sort of lifestyle / prevention question here. So we jump back to Kahoot. And the question is, which of these lifestyle choices will help reduce your risk of cancer? So you get eating healthy. I ate Swiss chard for breakfast, side note. I want that on the record. Swiss chard, raw for breakfast. Sitting less, staying active, or all of the above. 5, 4, 3, 2, and yo, big show of support for all of the above. Here's what happens when you're trying to get points, like you get more points the quicker you answer. That's why, because like first time we did this, I hit eating healthy right at like boom. Was that incorrect? No, it's just all of the above is more correct. So technically I should give those 2 eating healthies like 3 points. Anyway, it is all of the above. I want to see the updated, oh, you didn't do the updated, that's okay. Okay, we're going to go now to Dr. David Daw. He will be our third and final speaker. By the way, sorry, I should have said this again. If you had a question along the way and you missed the beginning, you can throw that into the Q&A, and we'll try and get to as many as we can at the end. If we don't get to your question today, we will take said question and post a response on Cancer Care Manitoba's website. Dr. David Daw is a medical oncologist at Cancer Care Manitoba and assistant professor, Max Rady College of Medicine, U of M. His areas of expertise are in treating thoracic cancers, as well as being the medical lead for Cancer Care Manitoba's initiative that is focused on improving the experiences and outcomes of older adults with cancer. He leads research focused on investigating treatment patterns and outcomes for frail and older patients with cancer, and he's awesome. Dr. Daw.
So you've learned about how cancers might develop, as well as how to treat cancers once they have developed. Now let's talk about how to prevent cancers. So if we can keep a cancer from happening, that's certainly the best outcome for everyone. And we're going to do that by talking about what are called modifiable risk factors. So lifestyle factors that if we change them, can reduce our risk of cancer, and also Cancer Care Manitoba's practice prevention campaign. So up to 4 out of 10 cancers may be preventable. So we might be able to avoid them if we engage in healthier behaviors, both on an individual basis and as a society. These are things like reducing our smoking. So not smoking cigarettes or cigars or anything else that causes smoke. Avoiding alcohol, eating healthier. So we'll talk about that more in a moment. Maintaining a healthy weight, being sun safe. So what does that mean? That means wearing sunscreen, trying to avoid too much unprotected exposure to the sun, getting checked for cancer as you reach the necessary ages for that, and getting vaccinated against things like HPV, which we know can lead to cervical cancer. And finally, reducing exposure to radon in your home, which is an invisible, tasteless gas that can accumulate in people's homes and may contribute to cancer risk. Cancer Care Manitoba's practice prevention campaign is especially focusing on 3 modifiable risk factors this year. 1, moving more, so being physically active for 2.5 hours a week, and trying to reduce sitting less than 6 hours a day. Eating healthier, so eating more fruits and vegetables, more whole grains, and less highly processed food, and less sugar-sweetened beverages. And maintaining a healthy weight. So that's a healthy weight for you. And the better that we're able to maintain that weight where we're feeling healthy and in the recommendations, the lower the risk of cancer. Overall, you can find more information at practiceprevention.ca. So this is Cancer Care Manitoba's website for our cancer prevention campaign. And it really emphasizes how all of this is about making small changes to your lifestyle that you practice over and over again. And through doing that over long periods of time, we can really try to reduce the risk of cancer for ourselves. And the same message goes for our loved ones. No change is too late in life where we can reduce our risk. Thank you very much.
Wow, man. See, these are like some little things in there, but it's massive. And we appreciate you, Dr. Daw. Okay, let's see how many we can get through here. Oh yeah, good start. Great start. Okay, Dr. Daw, we're going to call upon you. Can you give us some examples of foods we should eat to help lower our risk of cancer? And is Swiss chard one of them? I ate tons of it this morning.
Swiss chard is definitely one of them. You want to try to increase your consumption of fruits and vegetables and kind of whole foods, trying to avoid highly processed foods and sugar added beverages, those kinds of things. It's not that you have to cut out these other things altogether, but you want the overall balance of your diet to be more towards fruits, vegetables, whole grains, minimizing some amounts of like red meat, things along those lines.
Yeah.
And there's lots of examples and further indications on Cancer Care's website under the practice prevention tab.
Also, I don't even mean to keep talking about Swiss chard, but because food's mega expensive. And I bought this like big, huge, I don't know, you can call it bundle of Swiss chard. And it was like $1.59. And I'm like, okay, this is good for me. Food's ridiculously expensive. I'm like, this rules. Anyway, I'm not an advocate for the Swiss chard industry, although maybe I will be. Maybe that's my new thing. I don't know. It's good.
You can declare your allegiance to big chard.
I think I'm going to. I don't think there's a possible fallout from that. All right, let's go, Dr. Tchaikovsky. This is a massive question. Why is cancer so hard to deal with? Why haven't scientists created better alternative treatments? So that's big.
Yeah, it's a great question. I just wanted to start by saying, there are other chards apart from Swiss. And so, you don't have to just declare an allegiance with a foreign country. There's probably a Canadian chard out there. Cancer is hard to treat, primarily because it's a moving target. And, in the last, 100, 150 years, there's been an enormous amount of research into what causes cancer, how to treat cancer. And we've made enormous strides in treating cancer, But one of the challenges is that cancer is a disease of mutations. And so cancers mutate as we treat them, and they develop resistance to treatments. And so that's the thing that we've really struggled with over the years is how do you actually keep on top of the changing environment that a cancer presents to that treatment. So a very, very difficult thing to treat. But we have made some, our knowledge now is incredible. And so we are making some major strides.
Awesome. Thank you, Dr. Chakowski. I think you should be ready, Dr. Navaratnam. We talk about closing the gap and equitable care. It is essential in this province. So what steps is Cancer Care Manitoba taking to close that gap for all Manitobans,
Thank you. Before I go into the question, I hope we have planted the idea some of you will become those future scientists to find the cure for cancer. So we'll see. So thank you. Thank you for that question, and thank you for this question. So what steps Cancer Care Manitoba has taken? And the first one is closing the gap is bringing research more closer to care, which you just talked about, Dr. Chakowski talked about. So that's one that Cancer Care does. We have a research institute, and that is one thing we do. The second thing is the gap is the equitable care. It is unfortunate, our province or Canada or globally, there is lots of gap between different sectors and different people, how they access to care. So we do have programs to reach out to the underserved populations, whether it is elderly or First Nations, new immigrants, the different sexual preference, gender, and all that. So we have those programs. And third one is this reaching out to you to bring more prevention so that we could close the gap of early diagnosis and then bring better treatment. So thank you for that question. Thank you.
Right on. Thank you, Dr. Navaratnam. Does cancer affect older people more than kids? I'd like to direct that one to Dr. Daw.
Sure, thanks, Ace. Absolutely, cancer affects older people more than kids, which in fact, aging is the #1 risk factor for cancer. That doesn't mean aging is bad. Aging is good overall. We want to keep living and keep aging. But the longer we're alive, the more chance there are for those errors to accumulate in cells that can increase the risk of a cancer developing. But we're increasingly understanding the details of the best ways to prevent and treat cancer in older adults as well as younger people. And although cancer can happen in younger people, we also have strategies if it occurs in the young.
Appreciate that. Thank you, Dr. Daw. So this is hype. I think the more specific, Dr. Chakowski, the better. What do cancer treatments actually do to fight the disease? Like, I mean, we're getting very technical and scientific, and I love it.
Yeah, so boy, I think we need another hour and a half here to just start to dig into this. It depends which treatment you're looking at. So just as an example, one of the treatments that's giving us a lot of excitement right now, we are using a lot of what's called immunotherapy. So these are drugs that actually, if you like, wake your own immune system up so that it recognizes the cancer is foreign and it starts to attack the cancer. So that's one of the types of treatments that we use. Increasingly, we're using drugs called monoclonal antibodies, which will recognize an abnormality on a cancer cell and attack that. When we get into radiation, radiation actually damages DNA so that it can't replicate. So, every treatment we use has a different mechanism of action, and often we can take advantage of that. We can combine treatments and have what we call synergy. So, this drug does this and radiation does that, and together they work even better. And so those are the kind of things that that are getting an awful lot of attention these days, a lot of research.
Can you just keep your mic on for a sec, Dr. Chakowski? This one isn't on our thing, but I'm I'm just fascinated by, you showed that image and it was prostate cancer and it was the seeds. And like, that is so mind blowing to me that there's these little, like, am I explaining this right? If I was explaining this to, like, let's say my mom and dad, they're little seeds of radiation that give off a little bit of radiation.
It's radioactive gold seeds. And as that, if you know anything about radiation, as that decays, as those seeds as they decay, they let off radiation. And that actually just goes a little bit outside where those seeds are and kills off the cells that is around it. And so it's very specific. You don't cause damage beyond that radius.
This is why science rules, research rules, which we do some incredible work in this province. That is amazing to me. Dr. Daw, how many different types of cancer are there?
I guess the easy answer is lots, but a perhaps more specific answer is essentially any organ in your body that you can think of can develop cancer. And so there are literally hundreds of different types, especially when you consider for each organ that can get cancer, there are different types of specific kinds that it can get. So there are lots of different kinds, although they all come under that label of cancer. And we have to often consider different treatments or variations on treatments for each one of those kinds. So it's been getting more and more complex over time, but fortunately with better and better results.
I think we'll fit in one more. Thank you, Dr. Daw. Oh yeah, so going back to you, Dr. Chakowski, why does it have an effect on genetics?
So I'm not sure I entirely understand the question, but genetics underpins everything in our life. Our DNA and our makeup determines who we are. And if we start seeing mutations, if we start seeing abnormalities within that DNA, that leads to problems. And one of those problems is cancer. Sometimes those problems can be heritable. In other words, you can pass on a genetic mutation to someone else, and then you can have a hereditary cancer. Fortunately, those are less common, but that's something that we always have to look out for and think about as well.
Everyone, again, we appreciate you so much giving your time today and joining us. To our panel, thank you so much. And to those of you who joined us, we appreciate it, for real. And also know that there are a whole bunch of people behind the scenes who are running this technically and did a lot of work to make this happen. And a huge thank you to them. We will have a couple of questions for evaluation purposes on that Kahoot. So if you're still logged into the Kahoot, you can answer there. And then again, this we've recorded these sessions. We will post information on the Cancer Care Manitoba website, along with, if we didn't get to your question, it will be addressed well. So Dr. Navaratnam, thank you. Dr. Chakowski, thank you. Dr. Daw, thank you so much, all of you. And stay safe, everyone. Enjoy the rest of your Friday and weekend, and all the best.
Thank you.
Thanks,
all.
Ace.
Thank you.